when a couple comes to us for evaluation, most of the time the spotlight is on the women, saying that she has to get evaluated, she has to get investigated. The male partner goes through the investigation at a later point in time. Sometimes this blame game can be there. So you see, when infertility is evaluated or investigated, we come across around 20% of the cause being male factor infertility, and if we take a combined cause, both male and female, then it could contribute to up to 30% of the infertility reasons. So to understand that, we have to go beyond the blame game, let me explain you through a beautiful story. So there's a couple who comes to me with this history. They are married for nearly 3 years. The first year they avoid, and the second year they start to try for a pregnancy, and there is no success in the natural way of conception. So they go to the doctor and they get themselves evaluated. So here what happens is that the woman is going through all the assessments and investigations, but the male partner is actually denying, saying that I'm all fine, I'm all well, I'm healthy, I might do the test a little later. So okay, the woman thinks that it's fine and she goes ahead with the further treatment of simpler treatment for few months. So after 3-4 months of a simpler try, there is no success. So here the wife feels that no, we should get a semen analysis done, and she really insists and pesters the husband that no, he has to do the semen test. So on doing the semen test, they have a shock. They see that the count is 0, there is no sperm in the semen. So this really makes the women feel kind of cheated, or she feels that she would not have had to go through all the treatment and the medication that she went through if the husband had taken the semen analysis in the first go. So you would see that the doctors would insist that semen test and the female fertility evaluation should go hand in hand. But if there is a resistance from the male partner, then unnecessarily the woman is going to go through lot of investigations and lot of treatment as well. So now what happens is, the husband understands that there's some problem. He gets himself evaluated, and on the basis of evaluation, the doctor advises that there is a small chance of retrieving sperm through the testis. For this, the couple has to go through an IVF treatment. So they are ready now and they want to really go ahead with this because it seems that this is going to be their best chance. So a woman will go through the IVF process, and on the day of egg collection, which happens under anesthesia for the women, the male partner also has to undergo the procedure of testicular sperm aspiration. But unfortunately, what happens is there is no sperm retrieved on testicular aspiration. Now, this is something that is already counseled to the couple much before they start the IVF process, about saying that if the sperm is not retrieved, they should know what to do with the eggs that are taken out. So they were prepared in their mind, and they had decided that if the sperm is not retrieved, then they will go for the donor sperm. So they go ahead with the donor sperm and embryos are made. Actually, not so good embryos are formed at the end of 3 days, and the embryos are transferred, but pregnancy did not happen. So this was really a jolt for the couple, and they felt that what is next now? What are they going to do next? Because they have taken the best treatment and this has not resulted into a pregnancy. So now they thought that they will take a break because that itself was too much for them to handle. Now they did not do anything for next 6 to 8 months, and with this background they come to me for further help. So now, having understood this situation, their problem, I told them they can avoid taking an IVF treatment. Instead, they could try simpler treatment such as IUI with a donor sperm. So now the couple said that will it really work when the IVF has not worked? I said you have to give it a try. Unless you try, you will not know. And they have to be prepared. So they are counseled that they have to be prepared for at least 3 to 4 cycles of IUI treatment has to be taken before they consider the next level of treatment. They were counseled about what to expect from an IUI, what are the pregnancy chances, and IUI treatment was started. The first cycle was with some stimulation with oral medication and injections, which really took a longer time for this woman. She took a lot of injections for the first cycle, but the response was good. She had good response of 3 egg growing, and IUI was timed at the right time with a donor sample. But unfortunately, the pregnancy did not happen. So they were really shattered, and they thought that with 3 eggs, if pregnancy has not happened, will it really work if they try another few rounds of treatment? Again, the role of counseling the couple comes here. So they are really counseled well, and they are motivated to take another cycle. So I tell them that we will go ahead with a simpler treatment, that is just a natural cycle IUI, and try donor IUI in that particular month. So the woman goes through a natural cycle monitoring, and at the right time IUI is performed. Unfortunately, the second time also it doesn't work. So they are really kind of disappointed now. They are not having much hope here. But I have to tell them that they need not be disappointed, because that is not the end. They need to try few more attempts, at least 2 more attempts. With this encouragement, they take the third round of treatment again with a natural cycle monitoring and a IUI with a donor sample. And the third time the pregnancy happens, the pregnancy test comes positive. So they are really very happy. They could not believe that a simple natural cycle monitoring with donor sample IUI, it gave them a pregnancy. They were very elated. They were really very happy. So this couple is now around 4 to 5 months, and she's really doing good, and she's really very happy, and I could see that smile only then. But otherwise, all that 3 months or 4 months journey that she had during the IUI period, it was always a very difficult time for the couple, especially for the woman, because she is so much in anxiety, she is so much restless. Only after seeing the results, she could see that she is blessed now, and she is feeling happy. So seeing that kind of an expression makes us so happy that we are part of their journey. So what I would like to kind of tell you here is, what is it that I want to convey by telling you about this story, that sometimes if IVF has not worked, especially in such situations, one should not really consider that that's the end of it. Sometimes we do go ahead and do a simpler treatment and it works. Another point to be taken here or to remember is that when a couple comes for evaluation of infertility, it should always begin with semen analysis, because semen analysis is the first thing that should be done. If not first, at least both together should get themselves evaluated, because for husband it's only semen analysis. If that comes normal, we know that there is no other test that I need to do for the husband. But if it is not normal, if it is showing that the count is very low or no count, then I have a very clear roadmap of what is the next step that I have to do for this couple. So doing the evaluation together is very important, and this is something that one must take it as doctor has advised, because they are telling you with some intention, with some planning. I am Dr. Indu Mudhusudhan, infertility specialist obstetrician and a gynecologist at Samruddh Fertility and Urology Center with an experience of more than 22 years. Our motto is nurturing dreams and creating families is just not a slogan but a mission. Book an appointment today with us, and together we will help you achieve your parenthood dream become a beautiful reality.